Hi, this is Jill Schiaparelli. Welcome to HealthTech Talk Live, being broadcast to you worldwide on iHeart Radio. We're here on the floor of the UBM Canon Conference on Medical Design and Manufacture. We're talking to experts and innovators across the industry, trying to catch up on the latest trends in med tech. I have such an innovator here with me today. I'd like to introduce Vipul Davé. He is a research director and fellow at McNeil Consumer Healthcare, part of the Johnson & Johnson family of companies. He brings more than 20 years of expertise in product development, focusing specifically on biomaterials and polymers. And it's a delight to have you here. Welcome.
Thank you very much.
I understand that you were chairing one of the really important sessions today on new materials and polymers here at the UBM conference. Mm-hmm. Tell us about some of the trends and innovations and the hot topics that were presented at that session.
Yeah, so I think we had a collection of great speakers from industry, really looking at materials to replace metals with polymers was one hot topic. For making aortic valves, which has already been clinical right now, instead of a metallic valve. Okay. So that's a big advantage of using polymer applications for coronary heart disease. Another area is looking at some of these polymers for anti-infection, which are already coated on the implant, which will absorb with time. We're looking at in the afternoon session on fully degradable stent by Abbott Vascular. So really, instead of metals, we are using they are using biodegradable polymers.
Well, those are a really broad range of applications. It sounds like. What are some of the clinical benefits of why we would want to, for example, switch from metal to a polymer?
Right. So one big advantage of a polymer stent, for example, instead of metal, is that the stent erodes and goes away after a 2 to 3 years time frame, instead of being a permanent implant. So that helps the vessels to heal and go back to the natural state.
Is permanent implant bad?
Not necessarily. In some cases, like some of the orthopedic implants are permanent. In some cases, but in cases of cardiovascular, where you want the vessels to heal, go back to the natural state, so that the cardiologist can re-intervene the vessel, you need a material which will go away instead of staying as a permanent implant.
So that's the nice thing about these polymers. You can have a bioabsorbable material when it doesn't need to stay forever, or you can have something that stays forever if it's necessary. It's very, very tailorable. How exciting. Are there particular clinical applications, for example, you mentioned orthopedics, that are really driving this innovation, or is it more across the board?
It's more across the board in general. I mean, orthopedics, clearly they need it for anti-infection. They have some of the coatings which are biodegradable. For cardiovascular, you need, as I said earlier, a coating or a fully degradable stent. For some of these anti-infection material, which can be coated on a graft material, which can degrade and give the benefit of anti-infection. So the developments are across the board in medical device, and it leveraged in pharmaceutical also.
It's very exciting. Now, you clearly are an expert in this area. You've got patents, you've written book chapters, you've been doing research. And when you think back across your impressive career, 20 plus years, what are some of the innovations that really stand out in your mind as being very dramatic in healthcare and med tech?
The biggest one, I was involved in Cordis for cardiovascular disease treatments. I worked on fully degradable stent also at Cordis. So that's a big area where polymers are really being challenged to meet unmet clinical need. For example, fully degradable stent I talked about. Drug delivery aspect is also important, where you could have material which could be made from either biostable or a biodegradable polymers. And that's an area which was not as prominent maybe 15 years ago. Now it's becoming a mainstream.
Drug delivery being local drug delivery at the scene of where the implant is. Or systemic, wow.
So systemically, obviously, there are a lot of side effects, and that's why for cardiovascular, they were local drug delivery. And now leveraging material science for pharmaceutical application, which is what I'm doing now, is really creating novel dosage forms using different polymers.
It must be very gratifying and exciting to see these ideas go from benchtop to actually helping patients every day. So let's change topics for a minute. The floor here at the UBM conference on MedTech is exciting, a lot of innovation. What do you personally think the benefits of bringing all these different people together at a conference like this might be?
Right, it's a great question. I think at a conference like this, you bring in engineers with different backgrounds, you meet material scientists, you have metal, polymer processing people together,
Right.
and really looking at one end goal of developing better devices. And
Right.
you need an interdisciplinary approach. It cannot be one person doing
Right.
everything.
It takes a village, so
A
to
village,
speak, yeah.
exactly. And so this forum really brings people with different expertise
Great.
to really solve really significant problems.
It's excellent. Well, thank you for catching us up on all these exciting things. I'm here with Vipul Davé, Research Director and Fellow at McNeil Consumer Healthcare, part of Johnson & Johnson. Thank you so much
Thank
for
you
being
very much
with us.
for the opportunity.
I'm Jill Schiaparelli. This is HealthTech Talk Live. We're being broadcast to you worldwide on iHeart Radio. We'd like to thank the event sponsors UBM Canon here at the Medical Design and Manufacturing Conference in Philadelphia. A special thanks to 1-800 Public Relations for their media and PR support, and I wish you all a great day.